Hello and welcome. I am Professor Khalid Khan. I am at the University of Granada in Spain. Today we have with us Dr. Liliana Vaula from Rosario, Argentina, and we are going to talk about chronic pelvic pain and how best to provide long-term pain control. Liliana, can you introduce yourself?
Hi, I'm Liliana, and I'm an anesthesiologist, and I am also a pain control physician.
Thank you. Well, from the studies that exist in the literature, we know that chronic pelvic pain is a global problem. The problem is not just pain during menstruation, but also at other times unrelated to menstruation. And this type of pain can affect the quality of life of the sufferer tremendously. Liliana, you want to say something about that?
Yes, Khalid, that's a very big problem among young women and fertile women. And they can suffer a variety of symptoms, persistent or recurring pain during sexual intercourse or during menstruation, and the chronic pain, wherever it is felt, it embraces the whole life of the person, and we start having fatigue and sleep problems and anxiety and depression, and it's really difficult to resolve the whole pain.
Yes. So when we look at the causes of the chronic pain, there is relationship with pathology, but also there is strong relationship with psychological morbidity and history of abuse. In this systematic review of the literature with over 100 studies included, the conclusion is that endometriosis, chronic pelvic inflammatory disease, are related, obviously, as pathological causes, but certainly the associations with anxiety, depression, and abuse as a child or as an adult is a very strong factor. So it's a common problem. There is uncertainty about the best treatments. We'll come back to that in a second. But given that there are many factors overlapping, what is the best way to proceed with treatment in this situation?
This thing you're saying is a very critical thing, a very critical point when with a person that comes to us asking for help when the symptom is pain, chronic pain. It is very important to offer a multimodal approach. An interdisciplinary approach is fundamental. Not only seeking to resolve an organic problem, but emotional problems. Maybe they need some change in the lifestyle, and they usually need a psychological approach.
Okay, thank you. So this multidisciplinary effort is an essential feature of the planning of treatment. And obviously, research is ongoing all the time. Sometimes new research can create a new treatment option, but also it may eliminate an existing option that is shown to be ineffective through research. So here I'd like to show an example of the research effort required to make advances. Here we see a clinical trial about a surgical intervention to interrupt the nerve pathways to control pain. And this trial took over 10 years with 500 women recruited and then followed up for 1 to 5 years. And during the time this trial was ongoing, there were obviously other studies in other areas also ongoing. The findings of the studies in this area of the surgical treatment demonstrated that this treatment wasn't effective. And guidelines at that time, in light of the findings of the study, recommended that women should be offered this treatment only in the setting of research. But unfortunately, even 10 years after this recommendation, it appears that it remains in practice. For example, data from Australia shows that this intervention was one of the commonly used interventions. Perhaps when other things in the treatment options available to us are not working, we may even be persuaded to use things that we know possibly to be ineffective. Now here we see an overview of much of the research carried out in this area. The quality of the research is quite variable. And there are many options, including painkillers, physiotherapy, acupuncture, herbal treatments. How do we see all these options available, and what can we do with the evidence to provide the most evidence-based treatment, Liliana?
Well, first of all, we've got to start rethinking our way of treating patients. We Occidental physicians we are too organic, and we should start rethinking our whole approach to the patient, and not only give a chance to all of these different manners and ways of treating. For example, acupuncture has many answers when we are we don't know where to go treating chronic pain, and not only making evidence and investigating seriously these herramientas.
Yes, tools.
These tools, but also using associations of them.
Okay. So as I understand it, your recommendation is that we take a holistic approach. We don't just focus on pathology to cut it out with surgery or to suppress it with hormones or other treatment, and then consider a whole range of options available and combine them in providing choices to treatments which should be offered in the context of shared decision making, where information is shared.
Exactly.
And choices are made by the patient. Do you have any final message, Liliana?
For the patients, for the women who suffer from chronic pelvic pain, to seek for medical attention, for a proper diagnosis and a proper treatment, not only a medical treatment, but a holistic treatment.
Well, that's an excellent advice for me to emphasize to end this video, because pelvic pain has been a neglected problem.
Yes.
It's been demonstrated, for example, that it could take up to 5 to 10 years. The median is 8 years for a woman with the symptoms to obtain proper help. And I think part of the responsibility now is for people who have these symptoms to demand that they are given better care more quickly. So with this, I'd like to thank Liliana and bring this video to close. Thank you.
Thank you.